Frank.
Good evening, Mr. Clerk, please call the roll.
Chairman Rourke,
Here.
Counsel Belanger,
Here.
Counsel Mercia.
Here.
3 present.
Thank you. Thank you once again, everybody, for being here tonight. We're here for a Public Safety Subcommittee. Today's date, Tuesday, April 22nd. Getting right into it, motion number 1 is a response to the use of Narcan. Joining us this afternoon is Department of Health Director Frank Singleton. From Trinity, Jeff Stewart. From Lowell Fire Department, Lieutenant Keene, Lieutenant Potter, Lieutenant Ledoux. From our Police Department, we have Superintendent Taylor and Sergeant Fleming. From our City Council, Councilman Manazzo, thank you for being here. And also Anne Marie Page, President of the Lowell Citizens Council. Thank you all for being here. Mr. Singleton, I did contact you a couple weeks ago concerning the use of Narcan within the city of Lowell. Statements from you, please, sir.
Green light.
Yeah, the green light, the green light, okay. The governor, as you know, declared recently a public health emergency about the explosion of overdoses and deaths due to opioids, prescription painkillers, and heroin, and allows for the first time first responders to be able to carry Narcan under certain conditions by amending on an emergency basis the existing regulations. This decision to carry Narcan on first responders is discretionary. That is, you're not mandated to do it, unlike CPR training and some other things first responders are mandated to do. But given the explosion of these deaths and overdose situations to try to prevent death, we feel that having first responders have Narcan would be useful under certain circumstances. But perhaps Jeff Stewart could comment for a minute about the paramedics right now and the EMTs on the basic life support all carry Narcan as a routine part of their proposal. Jeff, you want to talk a little bit about right now what's in existence and whether this would be an add-on to an additional resource? Because the ambulance system that does respond does carry Narcan. However, neither the fire or police at the moment do carry Narcan as a routine. Jeff, you got to press the button, as I just found out, to turn on the sound there.
I think it's on. So, good afternoon, Jeffrey Stewart, Trinity EMS. Currently Director of Clinical Services and Education for the organization. Mr. Singleton asked me to come and give any supporting testimony or answer any questions regarding nasal Narcan and the utilization within the city. Currently, as Mr. Singleton said, we carry it at the ALS level, at the paramedic level, as well as all of our BLS units carry it and deploy it. I know that the fire department is working towards that goal as well, and I've had meetings with Chief Taylor on that as well. So that's for the departments to go from there.
You explain, come upon a scene where the paramedics arrive and the use of Narcan would be advised how that would be done?
Sure. Based on patient assessment, if it's deemed an opiate overdose or suspected an opiate overdose, if it's EMT basics, they would administer nasal Narcan. If it's paramedics, they'd also administer Narcan. They could do it nasally, intramuscularly, or intravenously. It's their option. So the paramedics have a little bit more wide of an administration route. The EMT basics and subsequently the first responders are limited to nasal utilization.
Okay, great. And then from our fire department, I know Lieutenant Potter is here. A couple of words.
First, thanks for having me. Second, the fire department is also, we're very supportive of the program. We think it's a great idea. So we're currently in the process. There's several logistical things that we need to take care of before we can actually put the Narcan on the apparatus. We have a few SOPs that need to be ironed out. We also need a memorandum of understanding with our medical director, which is Dr. Drake, and we need an education program that's approved by Region 3 to properly instruct our members on the use of nasal Narcan. So I'm working on the SOPs. I have a copy here if you guys would like to take a look at them. I've also talked to Jeff Stewart about developing a nasal Narcan education program, and Dr. Drake's actually currently developing the MOAs for us. So.
There will be a cost to the city in that the city has the state has a pilot plan right now, which is all full. There's only 5 slots that are available, so it's about $42 a dose. but to save a life, that's not much, and there's expiration issues and storage issues, et cetera, that have to be worked on logistically, but with the fire department, I believe it's 14 pieces of apparatus, that's not a large sum of money. We've talked to the police chief about whether it should be expanded to all the police, and maybe the chief would comment, but we thought perhaps it belonged more appropriately to a subset of the police department, namely the narcotics unit, that may stumble across an unconscious person in the course of their duties. If there's a medical call that goes into 911, you will get both fire and Trinity anyway. But if the police did find someone as part of, especially a narcotics investigation, that was overdosed, they would have to wait for those units to show. So that, Chief, maybe is something that might be what Boston, I understand, does, rather than try to do with 250 police officers and all the cruisers and.
Yes, thank you. What we discussed today is potentially setting up a meeting between the city's health director, the fire chief, myself, and also our medical advisor through Lowell General Hospital to develop what we think is the most efficient and best way to roll this out into the first responders in the city. And it may not be cost effective to put them in every police cruiser or give one to every police officer. But that's a discussion I think that we need to have with the medical people. But I think at a minimum, we've already trained our communications personnel so that they can assist people when they call that may have access to nasal Narcan for a loved one or somebody that they come upon. I certainly think it would be appropriate to incorporate this training and the nasal Narcan into our cell block area so that we can give it to people that may be in our custody. And then also, I think it may be appropriate to give it to our, essentially our drug unit that really works in that field and with that population of the city day in and day out. So I think at a minimum, that's what I'm looking at. And then we'll be subject to a larger discussion with other people to see how what's the appropriate way to roll this out.
Great, thank you. Councilor Mercia?
Well, dealing with, in the sheriff's department, we do see this on occasion. It's a very, very important subject that probably, if people aren't around, they don't realize the importance of this nasal Narcan to save somebody's life. Nobody wants to see someone overdose, but if you happen to know someone, and just because they do take drugs doesn't mean we still don't love them. But I want to say something that's troubling to me more than anything else, because I did make a motion, and I know it's probably not the subject, but I have to say it. I have a daughter that's highly allergic to shellfish, and if someone even kissed her, believe me, she'd be in the hospital. But yet I made a motion asking if an epinephrine pen were being in ambulances or fire trucks, and it isn't. And through no fault of anybody's self, my daughter turned 40 and became allergic to shellfish. I don't know why. We never had this problem before, and she could have died. If it wasn't for a fire department in Derry who happened to have an epinephrine pen, she would have died. Through no fault of her own, there are people out there allergic to peanut butter, different allergies, and yet we don't seem to carry them in a fire truck or at a fire station. You know, it's not like she's trying to be allergic to this. It just happens that you don't know what you're eating sometime, and it could contain a little something. So, Jeff, do you have them in your ambulances?
Yes, ma'am.
You
All
do.
of our BLS and ALS units have them.
You
and
do.
also the regulation that will be cited later, 105 CMR 171, which specifically addresses the first responder training, does give that option to the first responder units if they choose. So they do have that as an option under regulations, which were updated with the Governor Patrick Duvall's declaration. So that is available, and we would be happy to help the departments develop
They're
their
not in
educational modalities.
fire trucks. They're not in a fire station. Sometimes people are in trouble. They run right to a fire station for help, and there's no EpiPen in a fire station. I don't understand that.
I agree with you entirely, Counselor. I had spoken with Jeff Stewart with that as well. In conjunction with the nasal naloxone, we were discussing the epinephrine auto-injectors. the chief thinks it's a great idea. We all think it's a great idea. So in conjunction with developing our SOPs and the MOAs that we need with the hospital as well, that is actually another thing that I brought with me today.
Thank you for including
Yeah,
it.
so-
It saves lives.
So
Ple-
our goal is to get both of these on the truck as soon as possible.
That'd be beautiful. That's all I'm concerned. Thank you.
So Superintendent, maybe at that meeting you have, that can be brought up as well, the EpiPens.
Yes, that would, I would say that we should incorporate that as part of the discussion.
Great, thank
I
you.
appreciate it, because it's a personal thing with me. Thank you.
Council Belanger?
Yes, thank you, Mr. Chairman. This is a great motion by you, Councilor Rourke, that the use of Narcan is definitely in much need, to say the least. We already know that Governor Patrick has declared an opiate emergency just weeks ago. The town of Billerica is going through similar situations. When we interviewed city managers, their respective towns, this is a problem that's rampant. It's not just the cities, it reaches everywhere. It's everybody's problem. So I totally support this. I think we should absolutely start with the first responders, ambulance company, fire as well. I think holding cell is an automatic for something immediately, and then from there we'll decide. I mean, it may not be cost effective. I know it's roughly $40, very inexpensive, but however, it's still every police cruiser, that might be a little difficult. So let's start with the first responders, the holding cell, get that done, and then we'll let the respective chiefs figure out from there, and the professionals, if it's appropriate to should it be in every cruiser. So, thank you very much, Mr. Chairman.
Thank you, Councilor. And I know tomorrow, Lieutenant Keene, you're actually being trained on how to administer this.
Yes, I am. I'm taking a class down in Boston. The PFFM, Professional Firefighters of Massachusetts, have embraced this along with the governor. Obviously, he's declared a state of emergency, and as always, we're just looking to get involved. We're all in on this. The fire union is all in, the fire department, the chief. This is an epidemic. This is something that we have to talk about. We can't dicker about too much about cost and worrying about these things. Sometimes the right thing is just the right thing. There's always a cost associated, but I think it's kind of a simple choice to put these on fire trucks and get us. We're there fairly quickly, generally speaking. Between us and the police department, we're usually there first and second, depending upon our location at the time. And to get this administered as quickly as possible, without a doubt, would be a huge benefit to the people of Lowell. And that's what we're all here to serve. Everybody sitting here, I'm sure, would echo that sentiment. So we're all in, just so you understand that.
Great, thank you. Lieutenant?
There's one other player that's here. Actually, we have another program through Lowell House that deals with the families carrying Narcan and friends and people who are in contact with people. I just got a report from the State Health Department on unintentional opioid overdose deaths since 2000. The number for Lowell is 163. So if that was 163 West Nile cases or 163 cases of meningitis, would obviously, but 163 people died since 2000 in Lowell by death certificate review by the State Health Department's enumeration here. So it is an epidemic, clearly.
Great, thank you. Councilor?
Do we know how long the nasal Narcan spray lasts in a can, or is there an expiration date on it? How long is it effective for?
30 to 90 minutes, I understand, but I have to talk to someone who's more expert at it than I am. It does have a limited life. It also has a storage area. It has expiration dates, just like any other drug. But one danger of using it without medical review is that when it wears off, people can go back to using the drug circulating in their system. So there's a protocol that comes with it.
Right. There's a very important component to this, and I think this is what the training will entail. When you use this Narcan spray on someone that's about to die of an overdose and they come to, they feel like they're fine and they want to go home, and that's the worst thing that could possibly happen. You have to get them to a hospital. You have to give them medical treatment after that. You can't just say, okay, you came out of it, now you can go home, because you can't. But they will believe that they can go home, and they can't. So that's an
One
important
thing,
factor.
Counselor, that is being worked on at the state level is currently exactly what you're talking about, the necessity to get these individuals follow-up treatment at an emergency medical center. Currently, the state's public, the PC law,
Protective custody?
protective custody law only allows us to mandate that they go to a facility, either the
We
police
can't
station.
force them
For
there.
alcohol. So currently, what they're working on is to expand that law so it includes provisions like you're talking about exactly, so that we can get these individuals, once they come to, and mandate that they go for emergency medical attention at a hospital, because it is definitely necessary.
That's right.
And on the cost issue, there is a line item increase in the proposed budget for $815,000 to pay for Narcan being used by first responders. So if that does continue to be in the budget, that at least will allow some of these costs to be handled by the state rather than locally through our budget process.
Right.
Great.
Thank you.
Thank you. Anybody in our audience wish to speak? Name and address, please, sir.
My name's Paul Belay, 65 Elm Street, Rosemont Terrace Neighborhood Group. Thank you. First of all, Councilor Rourke, I would like to thank you for bringing this motion forward. And having the members of the police department and fire department here today. Chief Taylor, I was happy to hear you mention that after the use of the Narcan, that these young people will be able to hopefully get the services they need to help them get back on their feet and be rehabilitated. We lose too many young people to this awful, awful drug. Representative Tom Golden's been very active with the opiates, and I believe that because of the cost of heroin is so cheap, that our young people are using heroin instead of the opiates because it's cheaper, and they don't know how to use it. So anyway, having this Narcan provided by our first responders, I think it's a huge step to helping our residents in the city of Lowell, and I want to thank all of you for being here tonight, and thank you, councilors, for bringing this forward. Thank you.
Thank you, Mr. Belay. Anyone else? Name and address,
Hi, my
please.
name is Jackie Hayes. I work with the Lowell House. I am the Narcan Program Director for this area, for the community. We've had the pilot program since 2010. So we've done a lot of talks with a lot of people over the years. It's sad to say that what has happened in the state took it to this level, but I'm really glad to see that everybody's here and everybody's on board. I wanted to make a comment about after treatment, because what I do is I do the methadone clinic once a week, I do the detox once a week. I'm seeing a lot of the active users. And the biggest thing that we focus on, and we just had a call with DPH about it, is the 911, is when they get up, stay. Don't, take off. I talk to a lot of I say kids, but I talk to a lot of the users about that. Just go. They're gonna keep you for a couple hours until the Narcan wears off, and then, hey, you may get a detox bed. Because let's face it, on the other end, there's a problem with beds. So even if they do want to stay, sometimes they can't get into treatment. So that's another whole issue. But we do stress, I stress that. I do a lot of the agencies. Tewksbury State Hospital, I do every program in there. I train them. I enroll people. There's a lot of people out there carrying it now, civilians that have it. And it's just really good to see that we're all going to come together finally and be on the same page, and hopefully that treatment piece will come next. Because, everybody deserves a chance, and the only way they're going to get that is if they live. I have some papers up here that explains the Narcan and all the pilot sites that are there. You guys could take copies of that, and again, thank you very much.
Thank you very much. Anyone else?
My name is Anne Marie Page. I live at 26 Fremont Street in Lowell, and I am the current president of the Lowell Citywide Neighborhood Council. I just want to say thank you to each and every one of you for your time tonight. I know you've all had a busy day, and this is a very important subject. We are very grateful to the health department. They have sent representatives out to the different neighborhood groups at their meetings to try to explain how serious it is and to try to tell them what they need to do, what they need to learn, as you said, Rita, to save a life. And we want to thank you all for being on board. keeping us awake, keeping us aware of what's going on, and any way we can help, please do call on us. We appreciate all you do. We know you're all very dedicated. And safety, you all are our safety net, so we depend on you. Thank you kindly.
Thank you, Mrs. Page. Anyone else? Sir?
Hi, Peter Sang, health educator with the Lowell Health Department. So I just want to update you on our current grant we're working on is the Massachusetts Opioid Abuse Prevention Collaborative. As part of our strategy is to create community awareness on the topic, as well as reaching out to our pharmacy providers. I worked in retail pharmacy for a few years, so as a technician, so I think the pharmacy is one of the great avenues to advocate for Narcan dispensing. So I visited every single pharmacy in the city of Lowell. I believe Walgreens is already stocking Narcan. So I believe they're a huge champion, at least from my visits. The pharmacist is on board, the technician is on board. So when I heard that they are stocking Narcan, I was not surprised. So they're taking a huge step in doing harm reduction. This Massachusetts Overdose Prevention Collaborative is possibly a 7-year grant from SAMHSA, the federal level. So it goes down to the Bureau of Substance Abuse Services to Massachusetts DPH. So we just finished our first phase of the community needs assessment. We had 32 key stakeholder interviews. And from our interviews reviewing it, a lot of times is the education's not out there. It's a very sensitive subject, so I appreciate the time that you're calling this motion to speak about this opioid epidemic. You know, if we don't talk about it, we won't. The idea is to try to create the community to buy in, and I remember going to the CNAG meeting, the Centerville Neighborhood Action Group, and it was a packed house. I think it was only 50 community members, and I loved it. And every time we can try to spread the message, kind of educate the community, I think we can arm ourselves to protect our loved ones. So we work on children, adults, everything. So just seeing this right now and being an audience and watching that we are taking the appropriate steps to address this epidemic in our communities is great. And I employ great work. So thank you.
Thank you.
I want to commend you for the great, tremendous job that you do reaching out to the community. I know of your great work, and I really, truly appreciate the message and the education that you're giving the community. I know that firsthand, and I want to commend you.
Thank you so
publicly.
much. Thank you. Appreciate
Thank
it.
you.
Thank you very much. Also to welcome our city manager, Kevin Murphy, who is now here. Mr. Manager, would you say a few words on the subject?
I just gone to the Learning to Cope meetings at Saints Hospital and Lowell General, and it's just a moving experience. And that's when I first learned about Narcan and the really positive results that happen and the lives that they save. So it's very important, and I commend everybody that's making this program work in the city, and the city council deserves great accolades for saving lives.
Thank you, Mr. Manager. And also here tonight is our CFO, Mr. Healy. Thank you, sir, for being here. That's probably the most important thing. Actually, for a quick side note, it is great to see multiple departments of the city all working together, collaborating as one to get a very important project off the ground, hopefully instituted as soon as possible. Lieutenant?
I think the rollout of this program comes at a very good time as the shelter people, the people that live in the wintertime tend to move indoors, move to their summer encampments. We've seen them around the city. And speaking as one of these people, that we have gone up to a quarter of a mile downriver to find some of their encampments because one of them comes out and says somebody has overdosed on heroin. So having nasal Narcan to take to the point where EMS makes contact, usually it's the fire department when we're out searching. This rollout comes to address another issue, and that is in the summertime we pick up a different type of clientele, and they're not located in the apartment buildings or in alleys. They're actually out in the woods where we have to go distances to, and I have been out there where we've done CPR to keep the person viable until we got the paramedics or got the Narcan to the scene. So this will address another issue that we have in the city, and those are the homeless people that tend to gravitate towards the rivers and away from the city itself, urban streets, the suburban.
Excellent point. Yeah.
Great, thank you. This is a question for anybody here that could answer. How fast or how quickly can we get this going where it's on our trucks, it's in our cruisers? Lieutenant?
I could probably answer that best, Counselor. So basically, what I'm doing right now is I'm waiting for the region to approve the education component. I'm also waiting for Dr. Drake, who's our medical director, to forward me his version of the MOAs. Excuse me. Basically, we're just going to review the paperwork he sends me, wait for the approval on the education, and then start educating the members of the fire department. My best guess would be another 6 weeks to 2 months. And I know that sounds like a long time, but it's a matter of getting the approval on the education in return. And then when we teach companies, they still have to perform their other duties. So it's not something that I can get all 13 companies in the city, together and teach them all at once. That'd be a lot easier, obviously. Generally, we teach 2 to 3 companies at a time, 3 on a good day. So the process of educating our members will take a little bit of time, but I'm hoping 6 weeks to 8 weeks would be an ideal time frame.
I think the city would be thrilled if, inside of 2 months we'll be fully trained and ready to go. So, thank you very much. Anything else on this subject? No? Okay, second motion for this evening was a motion by Councilor Kennedy, it was seconded by Councilor Belanger. It was the City Council requesting the Public Safety Subcommittee to review the 2009 matrix study and work with the police department on a continuing basis to, number 1, satisfy the recommendations included in the study, number 2, develop up-to-date policies and procedures, and number 3, to make any improvements necessary to the Lowell Police eligible for national and state accreditation. On this subject, Superintendent Taylor?
Thank you very much, Councilor Rourke. Just a little background on what the matrix study is. The study was commissioned by then Superintendent LaValle back in 2008, and I believe it was actually delivered in 2009. So the study's approximately 6 years old at this point. Several very good recommendations were made in the study. I don't agree with all the recommendations that are contained in the study, but certainly several of them are noteworthy and several of them are in the process of being implemented. Many of the recommendations contained in the executive summary, if you had the opportunity to review that, there's approximately 28 recommendations. Many of those recommendations have been implemented by Superintendent LaValle and then continue to be implemented actually as part of the reorganization as we roll out. But there's 2 principal areas I think that are of concern, and I think that we can implement very quickly. The first one is the policy and procedures within the organization, and the second one is the accreditation, and they are directly related to each other. Approximately 2 years ago, Superintendent LaValle paid for and commissioned another delivery of updated policy and procedures from a company called the Northeast Police Accreditation Consultants. And they delivered to us in the summer of 2013, so last summer, a complete set of policy and procedures for our organization. So it's a little less than a year old now. Probably, I think they delivered them in August, I think. And then obviously there was a period of transition here with Superintendent LaValle leaving and then the interim position before I took over. So one of the first charges that I determined was necessary was shortly after I took over, I appointed a captain within the organization who's also an attorney, Captain Kennedy, to spearhead this project and get them finished. If I was going to give you an estimate, I'd say they were about 70 to 75% completed. They delivered to us the policy and procedures. We have to now go through and adjust them slightly for our particular organization and our method of doing business. And we're substantially down that road. We put together a policy group of command staff and other members of the organization to kind of refine and polish these off and get them rolled out and implemented. And so we are substantially making progress on that. One of the recommendations contained in the matrix study is that we give periodic updates to the city manager and to the city council on our progress. What I would recommend is that we do exactly that, that we would supply, if it's accepted here, monthly updates on the policy and procedures to the city manager and to the city manager to the subcommittee on what policies we've been able to roll out and how the progress that we're making. I have a self-imposed deadline to have this complete project completed by the end of 2014. I think actually we should be able to do it faster than that, but that's that's my personal objective here. I want to be the one that finally gets this accomplished for this organization moving forward. So, and that directly correlates into accreditation, because you really can't effectively do accreditation until you get your policy and procedures completed. That's really the necessary first step for an accreditation process. When you look at accreditation, there's two types of accreditation. There's national accreditation, which is CLIA standards. That's very difficult to obtain. There's only a handful of agencies in Massachusetts that are actually CLIA certified, and most of them are smaller university-type agencies and college agencies. There's a few, there's Danvers and the Newton Police Department are accredited, and the MBTA Transit. But very few municipal law enforcement agencies get that higher level of CLIA standards. We would have we'd have a difficult process trying to obtain CLIA certification because of our physical plant. Quite candidly, the plant over there is not conducive to CLIA certification. So, and quite candidly, I think that's going to be a ways off before the city finds the necessary resources to build a completely new police station. That having been said, we can certainly go with what most agencies are able to obtain in Massachusetts, and that's an accreditation from the Massachusetts Police Accreditation Commission. That is obtainable, and that's what I believe we can work for towards and accomplish that. So we have an accreditation manager that's going to work under the direction of that Captain Kennedy once the policy and procedures are done, that we will work towards the other aspects of accreditation. But if you were to look at the policy and procedures are probably 80 to 85% of, once you get your policy and procedures done, you're substantially well on the way to being accredited by the Massachusetts Police Accreditation Commission. So, and we can make periodic reports to the city manager and the subcommittee on our progress on both of those accounts. I'd recommend on a monthly basis. I think we can, turn out probably 4 or 5 policies every week. That's my objective here. And, hopefully get them done in very short order. And I think that's pretty much it. I think the Massachusetts Police Accreditation Commission is obtainable, and I think that's what we should work for.
Great, thank you. Council? No?
Very clear to me. Thank you. I
Yeah,
know it's a lot of work.
Well, it's absolutely necessary, though, Counselor. It's essentially our playbook for the organization, and it has to be done.
Well, it's one thing to have policy and procedures in place. It's another thing getting all your members to be on the same page with those policies and procedures. So I know it's a lot of work.
Right, thank you. Yes.
Thank you.
Yeah, thank you, Mr. Chairman. And Superintendent, thank you for your cooperation on this. I know you see the importance of this as well as the subcommittee does. Something nonetheless we absolutely have to achieve. And I believe the matrix study, again, it was dated 2009.
Right.
So I think a lot of action has been taken by former Superintendent LaValle, the interim superintendent, as well as yourself, to address a lot of those concerns. So I look forward to hearing your policies and procedures that you put in place to get us there even quicker. So I look forward to those future updates and meetings. Thank you very much.
We will do that.
Thank you. Councilor Milanazo?
Thank you, Mr. Chairman. This question could either go to the chief or to Sergeant Fleming. In the summary, in the executive summary, there was talk about recommendations about personnel and how they were deployed. Are those issues that need to go through a bargaining unit, or is that something that you, as the superintendent, can implement?
Well, it's kind of a mix. As part of our reorganization, again, that study is substantially dated now in terms of the way that we deploy our resources across the city, and especially considering our revitalizing our community policing efforts in the city. So that very much dated. But we have rolled out a lot more people in uniform, more people on foot and bicycle patrol downtown. We're using the segways now. So we substantially have increased our deployment of officers. And there have been some negotiations with different bargaining units in the city, and I will compliment them very much. All the bargaining units that we have to deal with for the police department have been exceptional at this point. They've been very much in a spirit of cooperation. There's been a very good dialogue back and forth, and so I'm very optimistic that we'll have, we'll be able to roll out all the components of this reorganization as we move forward.
Thank you, Chief. Thank you.
Thank you, Councilor. And before we move on to our last motion, I'm sorry, Sergeant?
On so they can hear me on TV. I hope you've heard everything I've said so far. So that's an example that I know of firsthand that I've been involved in. I've had meetings with Superintendent Taylor, and we're trying to move this policy along, but that's 3 years. That's one policy. The city has invested a lot of money on the hardware and the software for GPS, and there is no policy. And it's been 3 years, and I worked, matter of fact, the prior city manager hired an outside attorney outside of the city solicitor's office to work with me on this. And we had meetings with the gentleman, Attorney Feely, very nice man. But it's just another example of how cumbersome this issue. There's probably hundreds, I would say, of policies in the department, and some of them are extremely complicated. And so we want to do everything we can to work with the superintendent to make this
to get it up to date, because policies really should be reviewed on a yearly basis, and that's not the case now, and so we'll do anything to work with the subcommittee and the superintendent, the city manager. The policies and procedures, we think that they have to be more than just a document. It just can't be, this is the policy. It has to be a living, live document that's used. You just can't take it out when something goes wrong every 6 or 7 years and say, oh, you violated the policy. But in the meantime, it has to be something. We want to be able to use it as supervisors to hold people accountable, and that's the direction we hope that we can move. And I'd be willing to answer any questions or any.
Great. Thank you, Sergeant Fleming. Thank you very much. Anyone in the audience wishing to speak on this matter? No? Superintendent, quickly, before we get to our third motion,
Yes.
An update on the reorganization of the police department, how things are going?
Yes, very well, thank you, Counselor. We have continued to roll out components of the reorganization, including problem-solving teams in the neighborhoods, which have been very well received by the community so far. We've also, in the last 2 weeks, deployed 2 segways in the downtown area. I get quite a few comments on that, and again, so far, people are, both the offices and the people that live and work downtown seem to have received them very well. Approximately 2 weeks ago, we hired 4 additional police officers, lateral transfers. So they are going through a modified training program now. A few weeks, they're already seasoned police officers. They just have to be acclimated to our business practices in the city itself. We are looking to hire potentially up to 12 additional officers to start our police academy June 1st. And that includes, recently the city council was gracious enough to include in that group of 12, 5 additional officers, which you approved, and I greatly appreciate that, the support. As I've already talked about the policy and procedures, I believe I don't disagree with Sergeant Fleming's in general his assessment, and we're making substantial progress on that. And just as a side note, yesterday we supplied a contingent of officers that were responded to the Boston Marathon as part of our regional law enforcement council. So we supplied approximately, I believe it's in the vicinity of 15 to 20 total officers that went down there to assist in Boston, and I know they were in Newton around the Heartbreak Hill area. So we're very proud to offer our support to the greater Boston area as they deal with the Boston Marathon, and the officers performed admirably. We should all be proud of them.
Great, thank you. And I know the 3 of us all work in the Lowell area, and we've spoken, we have noticed the increased police presence on not just downtown, but in all streets in the city. So it's a job well done. Thank you. Our third motion for the subcommittee is a motion by Mayor Elliott and a second by Councilor Kennedy. It's for the city council to request the city manager to provide an update regarding the service zone plan and to refer this to the Public Safety Subcommittee for discussion. Lieutenant Ledoux, if you could speak on this, please.
The service zone plan is a CMR developed by the state in 2000. It was supposed to be factual and submitted by 2006. As we can see right now, it's 2014. The document is an alive, breathing document because as things change, for instance, I'll use one. It isn't just about ambulances. It isn't just about response times. It's about every school having an AED. It's about identifying nurses. It's about identifying where our assets are throughout the city and where they would be utilized in a situation where we had a mass casualty incident. But for day-to-day operation in the city, it specifically talks about the fire department, the police department, the EMS component, which is Trinity Ambulance, the ALS component, which is Lowell General, paramedics from Lowell General, along with the backup and partners of Pride Star Ambulance and other entities. UMass Lowell this year has become a Class 5 ambulance. That's an ambulance that doesn't transport. You see their little vehicles that says EMS. They're part of the city system. We've brought them in. We've trained with them in some of the drills we had to come in and utilize their resources. Again, it's only something that works during the school year, but we've identified them as a useful asset. The service zone plan is compiled, and it's information that has been drawn from every corner of the city, and the committee the overall community committee, we had a meeting a month ago, we had 28 people, is from the Board of Health to the fire, the police, the hospital, hospital staff, the paramedics, the EMTs. We had William Cass, who is the Region 3 Director for the state in here. We had a number of people who represent all the corners of EMS in the city. And the document is completed. It's being fine-tuned. We had a community review session, right, Frank? And the hands went up and moved it forward with some changes. We had a core committee meeting 2 weeks ago where more changes were approved and updated, and Director Cass of NEAMS is going to come back for a final meeting with the changes that have been voted in. And at that time, if we have a favorable result, he's going to take that document with him back to Region 3 to see their board of directors to forward that into Boston to be approved by DPH.
Great, thank you. Councilor Belanger?
Thank you, Mr. Chairman. Now, Larry, it sounds like that's the final hurdle. Am I accurate in that assessment for this?
If we are in agreement of all if the final committee comes together and all those issues are resolved as far as the city's comes, because the state is not going to accept anything if the city isn't in total agreement of sending a document to them. So the hope is that we, through these small meetings, these core meetings where we have representatives from every group, we've tried to knock out all the few issues that are left and compile a document that we can go through as a committee one more time with the state sitting next to us. And if that document is pretty clear, then he is willing to take that document forward to Region 3 to have it. The Board of Directors from Region 3 will look through the document, and if they're satisfied, they will forward that to DPH in Boston, and that is the final hurdle. I should say it goes to Boston. It could come back with some red pen that they want some changes in, but by no means is a long drawn out. They're just asking us to reword, or they're asking us for a request for more information on a particular subject, or to update something that they feel as though that our 2012 version, we send them a version of, about every year, and so they ask for revisions or updating as it did, because it's a living, breathing document. It changes.
Okay, well, I know it's been a long time coming, and sitting next to you for many of those ambulance contract hearings, this item is in big demand, so to speak. So I know you're working diligently, and we're all anxiously awaiting. So let us know what we can do to support you. Thank you very much.
Thank you, Lieutenant. I'm sure as the progress is made towards the final approval, that will be communicated to the same manager, and I'm sure he'll let us know when that's completed. So thank you very much. And once again, thank you all for being here tonight. Very valuable meeting. A lot of information was given. So to our police department, our fire department, the Department of Health, EMS services, thank you very much. Motion to adjourn?
Motion to adjourn.
Second.
Thank you very much. Have a good night.